As part of my visit the 34 Military Hospital, I here today for come talk to the commanding officer with Dr. Stephen Sivali and some of his staff in the hospital here, who say over the last couple of months we don't see a lot of developments don't they go on at this hospital. As we talk, we see the road construction way through the command ship now the 34 Military Hospital, don't contract no less a person. I'm a gentle group of companies for actually can do the road network at the hospital. And also as we talk, we see one of the oldest buildings now this hospital, they about to be demolished, where they get a new structure where they come up. Aside from the one way the first lady with Madam Fatima Biobi just commissioned, with a 104 bed facility for the hospital. But for now we get a better insight as to what really they happen. Are they today for talk to a senior nurse?
Okay, what about leaving a small diagnostic center at the bottom? And this administrative building that have been here for decades, they are going to strengthen the column and add one story on top. Okay, so it's going to be a complete transformation. Funded by our 7 the department of the from the main road by the petrol station that comes in, the main entrance, the main exit, and the entire road network in particular.
Yes, there has been an improvement because where I go, I've been left with old pediatric units still there, but where I come back, as I said, and don't demolish them, and now a new structure they go up. So I want to thank the First Lady for thinking about the hospital and putting the military hospital first. Well, infection disease control very important because it help to minimize infection at the hospital, and they also put the nurses on the card for make sure say they do the right thing and for make sure say they control the rate at which the infection is spread. So when I come back, I meet the nurses. They do a very good job. Even the one way I've been left in charge before I go, they do a very good job because most of about 98% of the patients that we come with COVID, they've been discharged in a very good state. Then we all become negative of COVID. So they do a very good job in taking care of the patients, in monitoring and making sure say the infection rates reduce at the ward. And we make sure say they still practice the measures for prevent the spread of COVID by the hand washing, wearing of masks, and make sure say the cleaners then they clean at all times. We patients don't discharge in our ward, we will disinfect, clean and disinfect. In the next coming years, the envision say that it could be the best hospital in the country. Not even one of the best, but it could be the best because we get specialists and we get nurses them with diligent and willing for work and take care of the patients. Because we not only be military officers for like defend the country, we serve military officers where they help to prevent sickness and make sure say the one we can our hospital and get the best services where we can offer to them.
Again, as I say, one of the many things that happen when I talk to Dr. Sivali, now that the Sierra Leone Commercial Bank is stationed to get an outlet here. It happened like say when it starts, payments of charges at the hospital, they be done over the counter. But as we talk now, it's been centralized. Everything where you pay for at this hospital now, by way of ensuring accountability and transparency, anything where you pay for now, you come through the bank. Then give you the slip. When I give you a slip there, and it slip down there, you go to the matron or you go to the nurse before ever they administer anything. As I say, the road network very soon in the next coming month, according to a promise by the gentle group of companies, the road network will get finished. We can imagine when the road will be nice because when you take the train for pull a patient from town, for come with town, you meet up a rugged road, you know the additional burden where you put on that patient. But when you don't take your time for actually make the road network for come to the hospital, that are one of the very many ways for address some of the challenges now at the hospital. So family na so I end my visit today now the 34 military hospital. Usai I can talk to Nurse Dumbuya. We don't give Ion side on how to manage infection, prevention and control. Where in the views of many people it seems to be central at any hospital setting.